we are going to be going over for, this week in class, or next week, I should say, next week in class. Where are we? So for this week, you guys already know we're doing chapter 15 and 16. You have this H5P. There is a technical error in there, and I've done everything to try to fix it. There is this one question, and it does have the correct answer on there in the key, but it's marking people wrong. And that is the question that is asking about the second heart sound. So if you believe that you are one of those students that was marked down for that question, and I think it's the question before the last one, just send me an email and I'll update your grade on that, okay? These are some recommended fun resources. We're going to do some of them together, and then the rest you guys can go ahead and do them. Like there's a crossword. I'd rather you guys do that on your own. You can print it out or just, write it out. And then make sure that you have your group presentation submitted here before the end of the week. I already have out here how we're going to be presenting next week. So we meet our usual lectures. It would be on Tuesdays and Thursdays at 1 o'clock. And that's when we're going to be presenting. Groups A through H present on Tuesday, the 10th at 1, and the rest of the class, so groups I through O, will present on Thursday. According to the rubric has been up there on our syllabus since day one, that you have to be present for both presentations, not just one. So, I'll be taking attendance. I'm going to have maybe one or two of the TAs kind of join me in there to be able to keep track of maybe messages that are coming in and attendance, so I can kind of more focus on the grading process. Both sessions are going to be recorded, so I can go back and if I need it to kind of refer back to the presentations for grading. Okay. The week to-do list is already up there. Chapters, the digestive system and the respiratory system. So whatever those two, I think there's 17 and 19. And then there's the discussion for the scoop on poop. It's kind of a very interesting discussion that, hopefully you guys like the videos and are able to have some really good input in there, just like the first discussion that we had. So this is the second and last discussion for the course. Okay, I still haven't recorded the lectures. I'm still working on the slides, so those will be up as usual before, over the weekend. And any questions about that? No? Okay. Yeah, okay, perfect. Now, let me do this first. So I'm going to just get rid of this for a minute. What did I do? Why do I do that? Okay. So we're going to go ahead and I want to start the review for chapter 15, and that is the cardiovascular system. Note that the cardiovascular system really has that lecture part, and that's what we're talking about this week. The lab portion is not until next week, though. Okay, so we'll learn about, like the different theories and things like very lecture. What is lecture material? The concepts and everything this week, but the actual lab portion, like how to take a blood pressure, pulse rate, things like that, we'll learn in lab in next week. So obviously everything is virtual, unfortunately, but that's, just what we've got to do. So let's first off do these activities. I need you to go back to that website. If you have left the website, I'll send it back in the chat. And where is the chat? Okay, so it's still there, but if you've joined us late, here it is again, folks, and I want to activate the first question for you. Okay. And again, nobody can see what you've answered. Take your best shot at it. That is really what counts. So the first question is asking about the outermost layer of the heart. Okay, you have the different layers and you want to make sure you identify which layer it is. And as we go, We'll obviously talk about what is the right answer. We'll also talk about why the other answers are incorrect. Okay, so that helps us learn a little bit. And if anybody has a question, either, unmute and ask, or you could type it in the chat. Okay, so the outermost layer of the heart is the epicardium. So great that everybody answered that. Is everybody able to get in there, or should I wait? Okay, if anybody needs me to wait and slow down, I'll do that. But if everybody's good, we can just go ahead. I see that Chuchi never came back. Okay, hopefully she's able to fix her audio problem. Okay, so the outermost layer of the heart is the epicardium. The endocardium would be the innermost layer. The myo is obviously the muscle layer in the middle. And the septum, that is the wall between either the right and the left atria or the right and the left ventricles. So the septum is right in the middle, dividing the heart into a right and a left side. Okay, so let's go on to the next question. And if there is ever too much noise coming from outside, let me know. So the part of the heart able to generate the largest force. Where do you think, which chamber do you think would generate the largest force from the 4 chambers of the heart? Again, if you get it wrong, that is totally fine. I'd rather, we get it wrong today as opposed to getting it wrong on the exam or on our quizzes. Okay, so I see that there is, consensus, or there was, that the largest force would not generate from the atrium. Oop, there's a typo. Okay, so the left and the right atrium, all they have to do is really pump the blood down to the ventricles that are underneath the atria. Okay, so those really don't have to pump very hard. It's the ventricles, so we're kind of like between, is it the right ventricle or the left ventricle? And remember that the right ventricle pumps the blood to the lungs, while the left ventricle would have to pump the blood to the rest of the body. Okay, so kind of knowing that, if I don't know if you guys can change your answers or not, but what would you think would now be the chamber that would generate the largest force? Are you guys able to change? Oh, okay, you changed your account. Okay, so the chamber is the left ventricle. Okay, so hopefully by today that you guys already, maybe listen to the recording or listen to the lectures and are just ready to answer questions, because from now on, I think this is really what we're going to be doing. Having you guys listen to the lectures, prepare, and then come on Thursday and we'll do questions together. Okay, so now the next question asks, the chamber that receives blood from the lungs is which chamber receives blood back from the lungs? Oops. Okay, so as you can see, the answers are coming in. And we're kind of split here 50-50 between the right and the left atrium. So try to think, it's extremely important. This has like tons of questions that surround this. Would be the cycle of the heart, the blood, how the blood circulates within the chambers and how it flows through all of these different valves. So you want to make sure that you're very comfortable with that cycle, with the heart cycle. So the chamber that receives blood from the lungs would be the left atrium. So letter B is the correct answer. The right atrium receives blood from the superior vena cava, inferior vena cava, and what is known as the coronary sinus, which is basically the venous blood coming from the myocardium itself, from the heart tissue itself. Can anybody tell us where the right ventricle gets its blood supply from, or not supply, but gets its blood from? So at some point, the right ventricle is going to fill up with blood. Where does that blood come from? From the body? Well, that's the right atrium. The right atrium is going to take, get all of that venous blood, and all of that venous blood will dump into the right atrium, and then it goes from the right atrium, pumped from the right atrium to the right ventricle. So the right ventricle really just gets the blood from the right atrium. Okay, so the chamber that receives blood from the lungs will eventually be the left atrium. Okay, are you guys good with this, or should we go over the cycle? To go over the cycle? Okay, so let me pull up those these slides. And now let me stop sharing that and start sharing the slides. Okay, so this slide is extremely important. Okay, it shows you how blood kind of circulates throughout the body, especially within the heart, through the different chambers and through the different valves. This part up here represents the upper, the cells in the upper part of the body, while this part represents the tissue and cells in the lower half of the body. So instead of drawing the head and neck and so on, we kind of just made that network of capillaries. And the same thing goes for the lower half of the cycle. Again, everything is happening at the same time, but in order to tell this story, we are going to start at the right atrium. So the right atrium receives deoxygenated blood, and deoxygenated blood is just a fancy term for blood that does not have oxygen anymore. Okay, so it's devoid of oxygen, and it's returning from the different tissues. It comes from the superior vena cava, inferior vena cava, and as I mentioned, the coronary sinus, which is the venous blood coming from the actual heart tissue itself. All of that deoxygenated blood, again, is gathered in the right atrium, travels through what is known as the tricuspid valve. It's a valve that has 3 cusps, hence the name tricuspid valve, and then it is pumped down into the right ventricle. The right ventricle will then pump that deoxygenated blood through the pulmonary trunk. There is a valve right here known as the pulmonary valve. The pulmonary trunk then divides into 2 pulmonary arteries, one for each lung. That is still deoxygenated blood, and you can see here that these blood vessels are still showing that bluish discoloration because the blood is deoxygenated, although we're still calling it an artery. And that's one of the things that kind of confuses students, that are these blue vessels, why are we calling them arteries? Well, the answer to that would be that we name blood vessels according to the direction of blood flow and not the kind of blood that it carries. So the direction of blood flow here is away from the heart. Okay, so these blood vessels are going to be called arteries. So again, from the right ventricle, through the pulmonary trunk, through these pulmonary arteries. And then this is where the blood will receive oxygen and dump all of that carbon dioxide. And we exhale that carbon dioxide when we do an exhalation or breathe out. all of that carbon dioxide is released out into the air, into the atmosphere. Okay, so that exchange of gas happens in the air sacs right here. Now all of that blood gained oxygen. So now all of that oxygenated blood will reach the left atrium through these 1, 2, 3, 4 pulmonary veins. And then from the left atrium, pumped down to the left ventricle through the mitral or bicuspid valve. So they're the exact same valve, it just has 2 names. And then from the left ventricle through the aortic valve to the aorta. And then from the aorta, it'll reach all the tissues of the body, whether it's the upper half or the lower half of the body. In the tissues, there's another exchange of gas, but that is the reverse. So now here in the capillaries, oxygen will leave the capillaries to the cells, while carbon dioxide will be picked up by the capillaries. Okay, all of that waste products that the cells are making, including carbon dioxide, will be picked up by the blood to be returned back again through the superior and inferior vena cava to the right atrium. So with that being said, this is a story that you folks need to be able to tell. Okay, so it's a very easy one once you know how things work. You want to have that mental image of the slide in your head and tell it to somebody. Tell it maybe, to a coworker or a classmate, maybe over, one of these meetings. Maybe anybody that you're living with, like a spouse or significant other or parents or kids or whoever. Just kind of go over this. If you do, okay, and I would recommend this, doing this if you live here in Michigan, but obviously mask up, okay. Go to the Detroit Science Center. They have an amazing heart model. Okay, it's huge. Like you can walk in. It's huge. Okay, you can walk in and take a look at the chambers, take a look at all of these valves. It's an amazing model that they have there. I believe if you live in the Tri-County area, it is free for people to live in the Tri-County area. But anyway, it's just an amazing thing to kind of see because you really get a sense of where all these chambers are and how they work together. But again, this slide you can get tons of questions from that one slide. Okay, so extremely important. Any questions about it before we go back to our, to our polls? Okay, anybody else had any questions okay, so we will move on then. Okay, so kind of going back to that one question that we're still on, the chamber that receives blood from the lungs is, and hopefully at this point you're comfortable answering that it is the left atrium. Now this next question, the left ventricle receives blood from and again, hopefully that whole cycle that we just talked about will make you comfortable answering this question. Yusuf, you're kind of loud, ya habibi. Okay, so let's go back and see what's going on. So the left ventricle receives blood from the left atrium. So I see that 100% of us answered that correctly. And I want to make sure that I'm sharing my screen so you can see what's going on and what other people are answering. Oops, wrong one. There we go. Okay, next question now would be, the heart pumps about how many liters of blood a day and contracts about how many times in an average lifetime. So an average lifetime is variable, obviously, from one country to another and depends on gender as well, but it is on average somewhere within the 70s. So again, I have no way of telling who was answering what or who actually answered and who didn't answer. So I'm just going to wait for a couple of seconds here to make sure that we all think about it first. So the correct answer here would be that the heart pumps about 7,000 liters of blood per day and contracts about 2.5 billion times in a lifetime. Okay, so the correct answer is the first option on our list. Okay. And you'll find that actually like one of the very first slides of the presentation for that lecture. Now the loose fitting sac around the heart, was that the epicardium, endocardium, fibrous pericardium, or the visceral pericardium? Okay, so the visceral pericardium is literally on the viscera. Okay, so visceral means organ. So visceral pericardium means the pericardial layer that is right, it is attached to, it's glued to the heart. You literally have to peel it off of the heart in order to see it. So it's definitely not loose fitting. The epicardium is the visceral pericardium. That's just kind of a fancier term for visceral pericardium. The endocardium is the inner layer of the heart. So the correct answer is the fibrous pericardium. When you look at the heart in a dissection, it's surrounded by lots of fat and lots of fibrous tissue because it is kind of an important organ. So it needs a lot of its own protection. And the fibrous pericardium is the correct answer. That is the loose fitting sac that surrounds the heart. You can very easily open it and, remove that layer. As I said, if there are any questions, please go ahead and let me know. So there's our next question, folks. In an EKG or ECG, the PQ interval indicates how long it takes for the cardiac impulse to travel from where to where. The EKG is another concept that you definitely want to be comfortable with. You want to make sure you're able to identify the different waves, why they're happening, what is going on. Is there a contraction in the atrium, or is it a ventricular contraction, and so on. It's important for both lecture and lab. Okay, so the PQ interval is the impulse, the SA node through the AV node. Okay, the P wave is when the atrium contracts. The Q is the beginning of the QRS complex, which is when the ventricle contracts. So the interval, which is the distance between them on the EKG pattern, is where the electricity is going from the SA node down to the AV node. Okay. Really quick, does anybody need to go over the EKG before we move on? If somebody does, please let me know. Okay. An abnormally slow heart is termed as what? What would you call that in clinical terms? So an abnormally slow heart is correctly termed bradycardia. So brady means to slow down. Tachy would be to speed up. Fibrillation, those are irregular heartbeats. Cardioversion would mean to revert it back to the SA node. So let's say somebody has, fibrillation and you want to convert them back to their nodal rhythm so that the SA node is controlling the heart all over again. That is known as cardioversion. Okay, so an abnormally slow heart rate is known as the bradycardia. Now, which of the following might serve as a secondary pacemaker for the heart? Meaning that if the pacemaker malfunctions and it's not working, what could take over instead? And that's known as a secondary pacemaker. So what might follow, what could become a secondary pacemaker? If the SA node isn't working, the AV node can take over. Okay, so the AV node would work as a secondary pacemaker, and so would the Purkinje fibers. So, they're kind of go in order. So if the SA node malfunctions, the AV node takes over. If the AV node malfunctions after that, then it would be the Purkinje fibers. Okay, so, but your secondary pacemaker would actually be your AV node. Okay, the rates would be SA node's about 60 to 80 per minute. AV node is about 40 to 60 per minute. And the Purkinje fibers are about 20 to 40 beats per minute. So you see that, they're slower as we go. And that's why, because the SA node is the faster, that's why it gets the upper hand. But again, they're much better than nothing. Okay, at least there is some kind of a heartbeat. Now, angiotensin II increases blood pressure by doing what? Am I still waiting for others to answer, or do we have all the answers in? Okay, so angiotensin II increases blood pressure by increasing the peripheral resistance. So angiotensin, from the name, means to tense the blood vessels. So what happens is that the blood vessel constricts. Okay, so if it was dilated, it would constrict onto the and hold tighter to the blood that's inside of it, and that increases blood pressure. That's known as an increase in the peripheral resistance. So angiotensin II increases blood pressure by increasing the peripheral resistance. It actually does another thing too, which is not here on the list, which would be to prevent the loss of sodium and water in urine. So it retains sodium and water in blood. And so that's another way. Remember, the nickname of angiotensin II is antidiuretic hormone. Now, which of the following is not a branch of the aorta? Okay, this is more kind of related to lab, although we kind of, you might guess it because we kind of went over it a while ago when we were talking about the blood cycle. So which one is not a branch of the aorta? Oops, I have to activate this, don't I? Okay. Now you should be able to see it. Okay, so this might be a harder one, folks. So try to go back again to the scenario that we talked about when we talked about the cardiac cycle. And remember that the pulmonary artery, that's kind of out of the right ventricle, where the right ventricle pumps the blood into the pulmonary artery. So it's definitely not a branch off of the aorta. Everything else on that list, the left subclavian, the brachiocephalic artery, and the right coronary artery, all of these are branches of the aorta. So your correct answer would be the pulmonary artery. Now, Marjorie has what is known as phlebitis. So what is she suffering from? Okay, phlebitis is inflammation of the veins. That's correct. The next one asks about Tim runs 5 to 8 miles a day. He has an enlarged heart and low heart rate and blood pressure. He most likely has, is it a very healthy cardiovascular system, or does he most likely have atherosclerosis or an arrhythmia or coronary artery disease? So in athletes, due to the all of the exercise and all of the training that they get, their hearts are a little bit larger than normal in order for them to perform better. Okay, so they would have lower heart rates and lower blood pressure, meaning that their hearts are able to perform the same amount of, the same job that mine would do, but mine would have to work harder and faster to get it. So definitely Tim would have a very healthy cardiovascular system. Now the second heart sound is called by is caused, it shouldn't be called. It's caused by what? So these heart sounds, when we're talking about at least the normal heart sounds, they are all caused by closure of valves. Okay, so it's the closing of valves that causes these heart sounds. Opening of a heart valve usually does not cause a sound. Okay, so S1 and S2 are caused by the closing of valves. In the case of S2, it is due to the closure of the semilunar valves, which are basically your aortic and pulmonary valves. Okay, the AV valves stands for atrioventricular valves, which are the tricuspid and mitral. Next one is the presence of albumin in the capillary blood leads to. So again, be sure you're very comfortable with the different kinds of pressures that are in the capillary and the direction, like what do they lead to in relation to the fluid? Do they pull in fluid to the capillary, or do they push fluid out of the capillary? So albumin in the capillary blood is basically, the question is asking you what kind of pressure does it cause, and does that pressure pull fluid in or push fluid out of the capillary? So again, make sure you're answering the question, even if, give it your best shot here. Presence of albumin is always going to be osmotic pressure, which is great, even though we've got two different options here answered, but at least we all agree that it does lead to osmotic pressure. And osmotic pressure is always going to pull fluid in. So your correct answer would be that the presence of albumin in the capillary leads to osmotic pressure that draws fluid into the capillary. Okay, osmotic pressure is never going to push fluid out. Osmotic pressure is a pressure that pulls water into the capillary, or if it was in the interstitial tissue, it would pull it into the tissue. But since we're talking in the capillary blood, that's kind of the scenario. Hydrostatic pressure is a pushing pressure. So hydrostatic pressure is actually caused by the pumping of the left ventricle. So that flow of blood into the capillaries, leads to that hydrostatic pressure, and that would push fluid out of the capillary. So you have these two opposing pressures. Osmotic pressure pulls into the capillary, and hydrostatic pressure would push fluid out of the capillary. Okay, so again, something that's really important to keep in mind, the two different pressures and how they play a role in filtration or in the making of the interstitial tissue. Now, assuming that all other factors remain constant, an increase in blood pressure will most likely result in, and we kind of already answered that question, but this is a good one to emphasize on again. So when the blood pressure increases, that's going to increase the hydrostatic pressure inside of the blood vessels, which will push more fluid out, will filter more fluid out into the tissue. So there is an increase in the amount of interstitial fluid. Okay, is everybody okay with that, folks? Any questions on that? Okay. The main process involved in gas exchange in capillaries would be so what is the force, or which process is involved in gas exchange in the capillaries, whether that gas exchange is in the lung or in the tissue? Okay, diffusion is correct. So it is a passive diffusion. It just simply relies on the concentration gradients of these gases. Which of the following changes will lead to an increase in blood pressure? So we talked, in the lecture, we talk about the different things that affect our blood pressure, what would increase it and what would decrease it. So you want to read these options and figure out which one will lead to an increase in blood pressure. Okay, so out of all of the options, the one that would increase blood pressure is increased blood viscosity. So when blood is thicker, that increases our blood pressure. So if somebody is dehydrated, for example, and now their blood has a higher viscosity, meaning that, again, the blood is thicker, that can lead to an increase of blood pressure. It's one of the, obviously in dehydration, they're hypotensive, but that's because of the loss of the fluid, loss of blood volume. But let's say a person that has anemia, okay, so they're anemic, low RBCs, low viscosity, low blood pressure, okay, so the changes in the blood viscosity go hand in hand with blood pressure. If it's higher, blood pressure goes up, and vice versa. Reduced heart rate would actually lead to a decrease in blood pressure. So when our heart rate goes down, so does our blood pressure. The reduction in stroke volume also decreases our blood pressure, And had this said increased vasoconstriction, that would have been correct. Okay, so increased vasodilation, and nobody chose it, but I'm just kind of going over it why it's incorrect. Increased vasodilation means that the blood vessels are dilating even more, and that would definitely lead to low blood pressures. Okay, so we've already, these are all of the questions that I had for chapter 15. And before we move on to the questions for chapter 16, does anybody have any questions about what we covered or anything about the chapter that they would like to discuss? While I pull up what I need for chapter 16. So does everybody feel pretty confident about the chapter, or do you feel like you still need to go back and do some revision on it? Like, how do you guys feel about it? Nobody's sure yet? Still need to review? Okay. Okay, well, it's good to know at least where we stand, because then we'll be able to improve on that. Okay, so these questions they're not available to you yet, but because I wanted to make sure that we go over it together first in this lecture, but they will be available, after the session. Okay, so what I'm going to do here, and everybody, we're not going to do teams because there's only 6 of you. So pretty much every person is on their own. We're going to do kind of like a Jeopardy thing. And if you know the answer, unmute and let me know. Okay, so let me go ahead and share this presentation here. Okay, you guys are going to have to unmute because it's going to get very hard for me to go back and forth between the presentation and between the session where I could see what you guys are typing in. So the lymphatic system and immunity, who would like to call? And obviously there's no real money involved, although in class I usually have fake money, Monopoly money that we use, but unfortunately I can't hand out those either. Okay, so who would like to go ahead and start off this game?
Can we start with the
anatomy? Sure, yeah. Okay, so anatomy for 100? Okay, let me hide this part. Okay. So all of these are functions of the lymphatic system except. So you're trying to look for the wrong answer. D is correct. Okay, so you can click on the answer and it'll tell you what it is. So it does not regulate body temperature. Our lymphatic system has nothing to do with that. But it does remove excess fluid from tissue. It will absorb, does help in absorption of fat from the digestive system together with the fat-soluble vitamins. And obviously it helps in defending the body against microorganisms and other foreign substances. So letter D is the correct answer. Okay, I want to keep track and see who's getting what. Hold on, give me a second here, folks, to get some pen and paper here. I am not equipped. Hold on. Okay, so who answered that? Okay, so Okaya got $100. Okay, so back to the game. So, okay, somebody tell me how Jeopardy works. Would it be Okaya that would claim, name which one she would like to answer next?
Sure.
Okay, Go for it. Ruqayya, choose. Did you say anatomy 300?
Yeah.
Okay. Okay, so given the question following, you want to give the correct order according to the sequence of fluid flow. So take your time. This is going to take a moment here. Let's see who can get this one first. Let's find out. Yep, we got a winner. So who is this again? Victoria. Okay, I'm gonna know your voice, your voices. Okay, I'll get better at this. I'll try at least. So Victoria, you got $300. Woohoo! Okay, choose Victoria. What do you want? Yeah, pretty much. Okay. So this statement best describes neutrophils. We'll find out. Let's see. So did you so did you say D or B?
D.
D. Okay. So this statement, neutrophils, remember, those were the first responders. Okay. So a couple of things you want to keep in mind, kind of like, reflexes when you hear the word neutrophils. You want to remember they're the first responders. They're phagocytic cells. They do make pus. Okay. So when they attack a bacteria or whatever, they are going to get killed in the process and they start making pus. Okay, so pus is basically dead cells and neutrophils. What else do you want to remember? That they have like these very funny shaped nuclei where they are polymorphs, meaning that the nuclei, each cell has a different shape of a nucleus. Okay, so they have multiple shapes. And they increase in bacterial infections. So these are the things that you want to remember when we talk about neutrophils. So in this case, it accounts for most of the dead cells. So what do we do if somebody gets the answer wrong? And who was it? That was okay. So what do we do? Do we minus 100?
Yep. Yep.
Okay, so negative 100 it is. Okay, so back to the game. So would Victoria get to choose again? You can tell I don't watch these shows, do you? I don't know, go for it. Just go ahead and choose. Did it disappear?
Yep.
Uh-oh. Let me bring it back up then. Is it back up? Okay, perfect. Okay. So this type of resistance is acquired as a result of developing and recovering from a disease. Well, we'll find out. And this is Victoria, right? I think I'm getting better at this. It is, you are correct. So that was plus 200. Okay, so you got 500 right now. Naturally acquired active immunity. And this is, you want to think about two processes. First of all, do we get sick? Is that a natural process or an artificial process? Okay, so you did get, or not you in particular, but this person got the disease, and getting sick is a natural process. Okay, active or passive means did the immune system, did my immune system actively make the antibodies, and that's why I have recovered and I'm now immune? Or did I passively get the antibodies from another source? So in this case, where the resistance is developed because I got sick and then made the antibodies, that is known as naturally acquired active immunity. Okay, so you're definitely correct. Okay, so I guess that means you get to choose the next one too. So let's go back to the game. Okay. These are all examples of mechanical mechanisms that prevent entry of microorganisms into the body except. Okay, let me hide that so I could. Okay, answer is E. That is correct. So who said that? Is that Ruqayya? Okay. So you now have 200. Okay, so the complement cascade is definitely not a mechanical mechanism. Mechanical mechanism means something, it's a barrier to prevent the organism from entering into the body. So tears washing, that washing of tears, saliva, skin, if it's unbroken skin, and cilia in the respiratory tract, all of these are mechanical barriers that try to prevent organisms from getting in. Complement cascade, that's something inside of the bloodstream, which means that the pathogen is already in our system. Okay, so the correct answer is cascade, complement cascade. That was correct. Okay, Ruqayya, go ahead and choose for us. Okay, so anatomy 200. This statement best describes lymph nodes. Can you guys hear my son, or is it just me? I'm gonna guess it's just me. Okay, good. And why is he not in class? That's another question. Okay, so any takers on this? This statement best describes lymph nodes. Any takers on this? Julia, you want to give it a shot? Jessica? Anybody want to give it a shot, folks? Yeah, sure. Okay, so it actually is not E, but I'm glad that you did try. So it will go through the different options to figure out why it's not correct. Okay, so the statement that best describes lymph nodes is that it filters lymph. Okay, had we said that describes the spleen, that would be filtering blood. Okay, so our lymph nodes are lymph filters, while the spleen is a blood filter. The lymph nodes do not have a network of collagen fibers. They actually have a network of reticular fibers containing venous sinuses. That's again talking about the spleen, not the lymph nodes. So the spleen, if you kind of went through the lecture, you'll find that a lot of our blood is actually inside of the spleen, and it's put into these lakes of venous blood. These lakes are known as venous sinuses. And then the T and the B lymphocytes kind of go in and swim in these little sinuses and kill germs as it goes, okay? So filtering blood containing venous sinuses would describe spleen, the spleen, not lymph nodes. Okay, so filter lymph would be the description of a lymph node. Okay, so, and because, I don't know who participated or what was I think it was Victoria, but I'm not sure, but I'll let this one. Okay, so just want to make sure that we're all participating here. So Jessica, you want to give it a try? Okay. Okay. So this statement describes antigens are foreign substances introduced into the body. Haptens are small antigens that are unable to produce an immune response on their own, stimulate an adaptive immune system response, or all of the above. Okay, so let's find out if that is correct. Yep, you are correct. All of the above. So the antigen, all of these sentences do apply to that. So you just earned yourself $100, virtual $100. Okay. So do you want to call another one for us? Okay. So anti-sera, whether it's, for rabies, tetanus, or botulism, what kind of immunity would that provide? Keep in mind that an anti-sera means antibody. Artificially acquired passive immunity is correct. Yep. So it's an injection. So this is something that is given artificially to the person. And because we're giving them the antibodies pre-made, in the factory or what have you, so that would definitely be an artificially acquired passive immunity. Okay, so you have now just earned 400. That was Jessica, right? Or am I wrong? Okay. Okay, you had a question? Correct. But so you're saying artificial active? Is that what you were asking about? Yeah, so these are pretty much the shots that we get as kids. Okay, so when we get like our um, diphtheria shots, tetanus shots as a kid, and so on, all of these we're actually getting parts of the antigen, whether they're dead or alive, and then we count on the body to make its own antibodies. So this is artificial active immunity. Okay, artificial being that we get it as a shot, but active in the fact that the body is actually actively making the antibodies for itself. And it's this kind that is the best kind of immunity. Okay, so the active immunity is longer than passive immunity because active immunity means that my immune system did all of the work. It identified the antigen, it made the antibodies. So if I need to make them again, I already have like that program, okay, in me. But getting the antibodies pre-made, I'll just use them, and then when they're gone, out of my system, I don't know how to make them again. Okay, so it's active immunity is more permanent, while passive immunity is more temporary. It's kind of a temporary immunity thing. Okay, so are you good on that? Okay, perfect. Okay, so Julia, we haven't heard anything from you. Do you want to give it a try? Is she still with us or she is? Okay. Okay, so maybe Julia isn't with us. Anybody else would like to give it a shot here? Oh, okay. Well, you can type it in. Where is the chat? Let me take a look at the chat. So she said the where to go? Grab for 400. Okay, so we got. Okay, this antibody accounts for most of our antibodies, can cross the placenta, and is responsible for Rh reactions. Oops, I need to make sure in case she types. So you're saying it's IgG. Okay, let's find out. You're correct. Yep, so it is IgG. Immunoglobulins G, those are the ones that can cross the placenta and are responsible for that rhesus reaction. So the erythroblastosis fetalis scenario that we discussed in the lecture, that is due to immunoglobulin G's crossing the placenta. Okay, anybody else? Or Julia, since you got it right, you go ahead. $100. Okay, so let's do that. Oh, I thought we did that one, didn't we? We did. We did 100. So you want to choose one of the blue ones. So let's do the 200. Let's try the 200. Complement is involved in, is it only an adaptive or only an innate or both? Okay, so you're saying it's only an adaptive. It is actually in both. Okay, so you'll find that the complement system is can be part of the adaptive system, meaning that it'll work regardless of the pathogen, and it's also part of the innate system. So it's part of both systems. Okay. And I just want to make sure that we go through as many questions as possible. So I'm going to kind of just go through them in an order to go through these, okay? Now, this statement best describes the spleen. So you're saying it's D. Let's see. Okay, correct. It does act as a blood reservoir. And it also does something very interesting, that if somebody is bleeding profusely, bleeding a lot, what the spleen could do is kind of squeeze itself and release all of that blood. And it's kind of like an auto transfusion where the person is transfusing its own blood and using that blood reservoir that was in the spleen and pumping it into their system. Okay, so the spleen is actually a blood reservoir. That is correct. Now for 500, if the right lymphatic duct becomes blocked, this effect would be evident. So what would you see in that patient? Okay. So you are correct. It is swelling of the right arm. So the right lymphatic duct takes lymph from the right head and neck, right shoulder and chest, and the right upper limb. Everything else is by the thoracic duct. Okay, so you are right. The right lymphatic duct, if it is blocked, that would lead to swelling of the right upper limb. Now questions about the innate or non-specific immunity. This group of protein is activated by a series of reactions. You don't even have to really complete the answer to this, complete the question. It's asking about a group of proteins in the immune system. Hopefully you already know what it is, in which one activated chemical activates another, and that leads to the promotion of inflammation, phagocytosis, and cell lysis. So there's a fourth option down there, which I can't get my screen to show. Where'd it go? Okay, it is sebum. That's the fourth option that was down there that wasn't showing. So which one of these 5 would be the right answer? So again, that cascade of events, or that group of proteins that are activated kind of like a domino effect in the immune system, would be the complement system, okay? So your complement system is what this one is asking about. Interferon, these are chemicals that are produced by the different immune cells, and they perform different functions, but they're not really proteins, or they don't lead to kind of the activation and the promotion of inflammation, phagocytosis, and cell lysis. That's not really kind of what they do. They're more involved in the activation of the different cells, okay? And they don't activate themselves in a series of reactions. So whenever you talk about proteins activation in a series of reaction, that would be the complement system. Interferons are antiviral proteins that stop viral reproduction in neighboring cells by preventing the production of viral nucleic acid and proteins. So is that true or false? It is true. Okay, so interferons is one of those chemicals that the immune cells use to communicate together. And one of the functions of interferons would be to prevent viral replication. And you want to always have hand-in-hand viral replication, which means that they are also can identify cancerous cells. Okay, so interferons is one of those antiviral, anti-cancer chemicals. So that is true. Now, dust cells, microglia, and Kupffer cells, these are all examples of, you'll find microglia in the central nervous system. Kupffer cells, you'll find them in the liver. And these are all different. I'm not sure if it was mentioned in the lecture or not. I don't remember, to be honest. But these are all different kinds of macrophages that are found in different parts of the body. Okay? They just have these like fancier names to them. Now, this condition does not occur during the inflammatory process. So you're looking for something that has nothing to do with inflammation. Look at letter D. Why do you think that would be the correct answer? It is, but why would you think so? Like, what would happen to blood vessels in inflammation? Would they vasoconstrict or dilate? Sorry, go ahead. They would dilate. Okay, so in the inflammatory process, blood vessels dilate, and that's why the area of inflammation is red, it's hot and swollen because of the dilation of these blood vessels. So vasoconstriction does not happen during inflammation. Okay, are you guys okay to keep on going or exhausted at this point? I'm totally fine. I've done lectures like for 4 hours, so I'm totally okay. But I just want to make sure that you're still with me here and you've not, kind of faded back away. You want to go ahead? Okay, perfect. So adaptive or specific immunity describes the function, this statement describes the function of antibodies. So when you think of antibodies, what do you think they do? Okay, we'll find out. You are correct. So antibodies do promote phagocytosis. And antibodies do a lot of things. They can actually directly kind of kill the cell or kill the pathogen. But what they do better is to promote phagocytosis. And they kind of hold on to the antigen and prevent it from doing more damage and call in these phagocytic cells and say, I've caught an antigen. You want to engulf it and digest it, okay? So that it does promote phagocytosis. Now, this statement describes B cells. And when we say B cells or T cells, we're talking about the B and the T lymphocytes. So what do you think best describes a B cell? Okay, so can anybody guess what it was? A is correct, yes. So B cells are stimulated by helper T cells. Helper T cell is that person in the back that does all of the work and takes really no credit for anything. Okay, so you'll find that the B cells make plasma cells and plasma cells make antibodies, and everybody talks about antibodies. Everybody talks about cytotoxic cells because they are kind of like the more aggressive cells where they can directly go in and kill cells. But really nobody talks about T helper cells, although they really do all the work. And that's why the HIV virus will literally paralyze the cell and prevent it from helping others. And that's how it destroys the whole immune system. So B cells, although they can identify the antigen on their own, but they can't do anything without being activated by T helper cells. Okay, so the B cells has to be stimulated and activated by these helper T cells. Produced in the thymus, those would be your T lymphocytes. Okay, B cells they start off in the bone marrow and they mature in the bone marrow. This best describes the activity of cytokines. So what do cytokines do? So cytokines has the ability to do all of these different functions. Cytokines, and you notice it's an S, these are pretty much all of the different chemicals that are out there that are produced during inflammation by the different immune cells. And when you gather them all together, they all promote inflammation. They all promote or stimulate the bone marrow to make more lymphocytes. Some of them have the ability to kill viruses and cancer cells. So the correct answer would be all of the above. There is a slide on the immune system in the chapter of the immune system that shows all of the functions of these different cytokines. Okay, so since it's not really asking you which cytokine it is, so all of the above would be correct. Which cell activates the rest of the immune cells? So this should be at this point hopefully an easy question to answer. So which cell do you believe would activate the rest of the immune cells? Can anybody take a guess at this one? And hopefully it's an educated guess.
3.
3, that's correct. Why did I name them 1, 2, and 3 in here? Anyway, but 3 is the correct answer. So T helper cells are correct. So again, B lymphocytes, cytotoxic, they might, B cells can identify the antigen, can't do anything. Memory T cells really has nothing to do with the first stage of the primary immune response. That is more of if I get reinfected again down the road. It's all about these T helper cells. Oops, I need to get my charger, folks. So I'm going to put up the next question and go grab my charger while you think about it. Okay, so how are we doing, folks, on this one? I really didn't even get the chance to read it yet. Okay, say that again, please. C. Let's figure. Like I said, I didn't read it yet, but let's go straight to the answer. A vaccine produces effect by stimulating a primary immune response. Correct. Okay, so again, your artificially active acquired immunity. Passive natural immunity results, or naturally acquired passive immunity, same thing, results from the transfer of antibodies from a mother to her child across the placenta before birth. Is that true or false?
False.
Okay, so why are you saying it's false?
Like it is
Yep, so it is naturally acquired immunity. That's what the question is asking. So it is naturally acquired immunity, and the baby is getting these passive antibodies, meaning that the baby doesn't have to make any antibodies on their own for a couple of months. So this is actually a true statement that antibodies that pass from a mom to baby through the placenta, they provide the baby with what is known as a passive natural immunity, or in other words, naturally acquired passive immunity. These antibodies are going to remain in the baby for a couple of months, and then they are going to die off and disappear. But by that time, during those couple of months, the baby's immune system is able to pick up and try to, will make antibodies on its own through all of the injections and so on that they're getting, all of the different germs that they're being exposed to and so on. Okay, so this is the incorrect statement. So we're almost there, folks. Booster shots. Why do we get booster shots? They are given sometime after the original dose was administered for these purposes except. So for example, especially if you work in the field of healthcare, you would have to make sure you get your tetanus shot, and then every 10 years you have to get a booster. So why do you think that is? For A is correct. Oh, it is not correct. Okay. Stimulates a secondary immune response. The original except. Okay. I was wondering, wait a minute. Okay. So I kind of forgot the except portion. And I guess because I asked it incorrectly, maybe that's what confused you. But one of the reasons that we do take a booster is to stimulate the secondary immune response. We do want to make sure that we are making large amounts of the antibodies. So we do not take it because of the original dose has worn off. The original dose is still there, okay, but we just want to make sure that there are enough antibodies. We always have enough memory cells in case they are needed. Okay, so with the exception of the wearing off of the original dose, these other reasons are correct. Okay, sorry if I confused you folks. That's my bad. Now for the grab bag, this is an example of innate immunity. So remember, innate is that very non-specific. It's a very general kind of immunity. And your body will respond to any organism, any pathogen trying to enter the body using different things. So which one of these is an example of innate immunity, or is it all of the above? Okay, so the correct answer would be all of the above. Okay, so innate immunity would be tears and saliva washing away. Those are mechanical. Vasodilation, that's part of the inflammatory process. Neutrophils, phagocytosis, that's still innate immunity. Activation of the complement cascade, remember we said it's both innate and specific. So all of the above, all of these are examples of innate immunity. And I think we've got one more to go. Now these immunoglobulins cannot cross the placenta, but they are responsible for transfusion reactions, meaning that if somebody gets an incompatible blood transfusion, they get the wrong blood transfused into them, which one of these antibodies is responsible for the agglutination reaction that happens? Okay, so IgA and IgEs are in secretions. So like in sweat, salivary glands, Any exocrine secretion would have IgE, the vowels, E and A. It is actually the IgMs, okay? IgMs are the ones that are responsible for transfusion reactions. Remember when we talk about like blood type A, they have antigen A and antibody B. That antibody, if you look at the chemical composition of it, it would be made out of an IgM kind, okay? It is just against antigen B. Okay, so, if you don't want to get, too deep into this, just make sure that you know that IgM cannot cross the placenta. It is responsible for blood transfusion reactions. That's kind of what we're getting out of this question. Okay. Out of the other questions that we kind of talked about was that IgG can cross the placenta, and it is responsible for the RH dilemma that happens if the mom is RH negative and baby is RH positive. Remember, the first baby, nothing happens to it. It's the second baby that gets affected. Okay, so that was actually the last question on here. Hopefully you guys found this to be useful. And, more students would be willing to join us and kind of go over these different ways of kind of going over the material. So what do you guys think? Like, what's your feedback on that? You like this one too? Okay. I'm glad, because I do too, and I really think it helps students better.